Good morning. This is Jeff Breedlove with the Georgia Council for Recovery. And I am with Larissa Guerrero, our incoming executive director. And we wanted to visit with you today and give you an update, as we understand it, on the important issue of the opioid settlement in Georgia. As you know, or may not know, Georgia has received some $630 million as our part of a one of the many settlements. This is by far the biggest one. And we just want to do a simple thing, and that's to make sure that the voices of the survivors, who are peers, are included in the process formally, and that the voices of family members who've lost someone to this disease are included formally in the process. So with that in mind, I was very fortunate to get some time on her busy schedule. And I just want to let Larissa and I kind of talk about this with you. So, Larissa, my first question to you is, why is the opioid settlement itself so important in the first place to both the Georgia recovery community and to families who've lost someone to this disease?
Yeah, well, thanks, Jeff. First and foremost, we are in the midst of an epidemic. So Georgia is in the midst of an epidemic. The number one cause of death in America for people 18 to 45 is fentanyl overdoses. And then if you look at some of the recent CDC data that came out, it lets us know that overdoses and COVID were the only two medical issues that contributed to the decline in life expectancy in the United States, which that's a huge issue. So decline in life expectancy due to COVID and overdoses. So this settlement money, it's a historic opportunity to effectively be able to fund programs that will have a really meaningful medical and practical impacts across the spectrum. And that spectrum includes prevention, treatment, and recovery. So it is imperative that Georgia gets this settlement funding right.
You're quite right, and you're on target. And those words that you just said are very important. So let's talk about the process for just a minute. So, as we understand it, and I want to qualify this, we are going on information from multiple sources. We have done our due diligence, and these are sources that we do trust in our state government, but we want to qualify everything we say by things could change at any moment in time. And it's definitely a fluid situation. But the state is going to take 30% of the funds and sort of manage them themselves from a statewide perspective through state agencies. Primarily DVHDD. And that's one part of this. Then the 70% of the remaining money is going to flow down to 11 regions that the state has designated. Now, those, simply put, are the 6 DVHDD regions that already exist. And if you're in this behavioral health world, then you should know or can easily find out by Googling DVHDD regions what the map literally it'll show you a map of what those regions are on your Google search. Those 6 regions plus the 4 most populated counties, those are DeKalb, Gwinnett, Cobb, and Fulton. So the big 4. And then the city of Atlanta itself, not Metro Atlanta, but the city of Atlanta as a legal entity. Those make up the 11 regions that we will be referring to moving forward in this conversation. Now, that 70%, there's some things we do know. In each of those 11 regions, there is up to 3 automatic votes that get a say in the process. And transparently speaking, those are some representation of law enforcement, some sheriff, some hospital representation, and the CSBs. And our posture is, that's wonderful. We have no objection to that whatsoever. There's 4 optional votes per region. So there can be a minimum of 3 and a maximum of 7 votes in each region as to how the money is spent. And that's what we want to talk about moving forward, is those 4 optional votes. So that lays the land for you. So, Larissa, I think, what I want to ask you is, with that process I laid out, what's most important to peers and families?
In one word, and we'll say this over and over again, the one thing that is most important to us is inclusion. So we want to have peers, which are people that have survived substance use disorders, as well as family members who have lost a loved one to the disease, to both have a voice and have a vote in the process. So again, like Jeff said, at the state level, there are conversations happening with senior government officials to have a peer survivor and a family member appointed to the council that will advise Governor Kemp throughout this process. And it would be terrible if the only voices on the council advising the governor were just those clinical law enforcement and state employees. The governor needs to hear the voice of lived experience to really best know how to spend these precious dollars. And then if we're thinking about it on the local level that Jeff discussed with these 11 regions, right now it's unclear, and frankly, it's not transparent on how the process will work. So we know that there are 3 guaranteed votes per region, again, law enforcement, hospitals, and community service boards. And we also know, again, that there are those 4 additional votes that are possible. So we've heard from survivors, peers, and family members from communities across Georgia over and over again. And it's our united position that each region must fill those 4 optional positions with 2 peer survivors and 2 family members who have lost a loved one to the disease. So we believe that any vote that takes place regarding the opiate settlement funds without a peer voice and a family member voice and voting is, it's basically illegitimate and a discriminatory vote. We have to be included in this process.
That's well said, Larissa, and you're right on target. That's an excellent point. Why does the Georgia recovery community, why are they united? Why do we feel so passionately about representation and having a vote?
Those of us that swim in it every day, work in this field, that we hear about stigma over and over again. But most importantly, those of us with lived experience, we know firsthand what stigma does to people. So stigma leads to so many things, including isolation, which eventually leads to death. And it also leads to discrimination and exclusion. So having a vote in a local region or having a council advise the governor without our votes and the voices of peer survivors and family members who have lost a loved one to this disease, it would be exclusionary and discriminatory. So it would be, if we think about it like other chronic long-term health conditions, if they're making a plan about supporting breast cancer survivors or heart attack survivors, and they don't include heart attack survivors or breast cancer survivors in it, we wouldn't see that happen. So there's a stigma surrounding addiction, surrounding people in recovery that is more prevalent than it is with other long-term health conditions. And then another reason it's important to be able to best spend these dollars, there is a long list of examples of wasted money and failed programs designed to address the issues of addiction that have one common denominator. They're all decided by experts with zero input from peers or from family members. So it's important, can't stress this enough, important that our leaders hear the voice of lived experience. They hear what people actually in this community and people that have been through this struggle before, they hear the voices of people of lived experience and respond to that.
Larissa, thank you. Those words are so important and they need to be heard by every elected official, by every staff member, from the governor's office down to the smallest county and city in Georgia population-wise. Let me ask you one more question, Larissa. In closing, what is your direct message to Georgia's elected officials?
Be inclusive. We're not asking that all the funding go to us. We're just simply asking that to be inclusive of the process. So understand the true experts, they're peer survivors, family members who have lost loved ones to this disease. And we know firsthand the hell of this issue, and we know best what will and will not be received And therefore, we have a chance to make this funding as successful as it can possibly be. So just give us a vote and give us a voice so we can help save our lives.
Thank you for your leadership, Larissa. And I know that the council, the Georgia Council for Recovery, we've convened multiple times, statewide Zooms. We were talking with stakeholders during the General Assembly from across the state. We've been working with the General Assembly Working Group on Addiction and Recovery and the General Assembly Mental Health Caucus. We know that members of the General Assembly agree with us that they want their constituents to be included, both their civilian constituents and their local elected officials, to know what the process is so that they can nominate people locally to be involved. So it would be important for everyone from Governor Kemp on down to understand the intensity and the seriousness with which the Georgia recovery community, and that includes peer survivors and family members who have lost someone to opioids, is taking this opportunity, this historic opportunity, and to miscalculate how seriousness and how intensely we are focused on this would be a mistake. It is imperative. If you say you're for recovery, if you say you support peers in recovery, if you say you support family members who have lost a loved one to this disease, that you just simply do what Larissa's been talking about, and that's demand and show your support for a transparent process, especially in these 11 regions. There must be a public roadmap. Elected officials must know how to nominate peers to have a vote and a voice. Civilians, people, taxpayers, whatever you want to call them, they should know how to apply in their own right and where to apply and what the process will look like. So it's important that Georgia get this right because lives are depending on it. Larissa, I want to thank you for your time. And I want to thank all of our stakeholders who are supporting us in this process. And want to ask other stakeholders to understand how important this process is to our community. And with that, we'll just say, as we always say, that recovery is real.